The Chn Bag. It is an essential and indispensable equipment of the community health nurse. Guiding principles in the use of public health bag. Content should be prepared by the one who will make the home visit. For cleaning, the inner part of the bag should be clean and sterile. Should be done every after home visit. For contamination, the less one opens the bag, the lesser chance of contamination. In general, the bag is opened 3 times. First, putting out materials for hand washing. Second, putting out materials used for nursing care. Lastly, returning all what has been used.
Contents of the Chn bag. So first we have the soap in soap dish. Second is we have the plastic and used wrapper. We have tissue papers, waste receptacle, apron, towel lining, match, 2 test tubes, a test tube holder, a dropper, sterile cotton balls, kidney basin, medicine glass, disposable syringe 5 ml and 2 ml, disposable needles, gauge 22, 23, and 24, thermometer, oral and rectal, cord dressing pack, which are sterile, tongue depressor, plaster, and OS. Next is we have a bottle containing 70% alcohol, denatured alcohol, soap and solution, sterile water, hydrogen peroxide, and acetic acid. Lastly, we have the spirit of ammonia.
First, the bag should contain all necessary articles, supplies, and equipment which may be used to answer emergency needs. Second, the bag and its contents should be cleaned as often as possible and replaced and ready for use at any time. Third, the bag and its contents should be well protected from contact with any article in the home of the patients. Consider the bag and its contents clean and/or sterile, while any particles belonging to the patients so as dirty and contaminated. Fourth, the arrangement of contents of the bag should be the one of the most convenient to the user to facilitate efficiency and avoid confusion. Fifth, hand washing as frequently as the situation calls for help minimize or avoid contamination of the bag and its contents. Sixth, the bag when used for communicable case should be thorough, cleaned, and disinfected before keeping and reusing.
Bag technique is a tool by which the nurse during the home visit can perform nursing procedure with ease and deftness, saving time and effort with view of effective nursing care. At the front of the bag, starting from left to right, we have oral thermometer, rectal thermometer, syringe, and needles. The right side of the bag, we have test tube and test tube holder, medicine dropper, match, alcohol lamp, and denatured alcohol. The center of the bag, we have kidney basin, calicurve or calistrate, umbilical scissor, bandage, sterile OS, cotton balls or cotton applicators, hand towels, and soap dish and apron. On the top of the packet, we have sterile gloves, cord clamp, paper waste bags.
So for the procedure of the bag technique, the first thing that we will do is to assemble all the equipment since organization facilitates performance of the task. Second is explain the procedure to the client, and explanation facilitates cooperation.
Good afternoon, ma'am. I'm a student nurse po from NDKC. I am Jenica Badilla. Nakakadari, ma'am, para mag-check po sa inyong ihi kung may albumin or sugar po.
Third is place the bag on the flat surface. It's either the table or the chairs lined with the paper lining. This paper lining serves as a protection for bag and its content. Fourth is ask for water to wash your hands or ask where you can do it. Hand washing prevents the spread of microorganisms. Fifth is open the bag and take out the double wrap soap dish containing soap wrapped in a plastic bag and tissues between the double wrapper. And then close the bag. Next is wash the hands with... Close the bag and then Wash hands with soap and water under running water or using pouring method and wipe them dry.
Ma'am, na may tubig ko.
Yes po, naa po. Then, place used tissues between the double wrappers. This is to prevent infection from the care provider to the client. Next is puts out all the equipment for the procedure to be used for the specific nursing care and arrange them on the spread paper lining. It should not exceed the paper lining. All equipment is placed in a paper lining to prevent contamination. Next is place waste receptacle outside of the paper lining. And then, put on the apron, proceed to the specific nursing care or treatment. Apron is a protection for the nurse who will perform the procedure. And then, we're gonna close the bag for the second time. Next is to proceed on the specific nursing care or treatment. It's either the urine test for sugar and albumin. Urine test for albumin. So the purpose is to test the presence of albumin in the urine. So albumin is normally found in the blood and filtered by the kidneys. When the kidneys are damaged, abnormal amounts of albumin leak into the urine. This is called albuminuria. So for the preparation, we will need first is acetic acid, dropper, test tube holder, test tube, match, kidney basin, alcohol lamp. Lastly, we will need urine specimen 20 to 30 cc.
So urine specimen should be collected early in the morning, before breakfast, and after the external douche. Light the alcohol lamp. Urine specimen are collected at the client's first voiding in the morning, since the bacterial counts are highest voiding is post. Second, fill the test tube 2/3 or 3/4 full of urine. Heat the upper portion only of the test tube with urine to be able to compare results with the bottom part of the test tube. Fourth, after the urine boils, if there is no change in the heated portion when compared with the unheated portion, the result is negative. Fifth, if there is cloudiness after boiling, add 5 drops of acetic to the urine. Acetic acids confirms the presence of albumin in the urine. 6. Reboil the urine. 7. If the cloudiness disappears after boiling, the urine is negative for albumin and cloudiness is only to the presence of phosphates. 8. If cloudiness remains after boiling, it is positive for albumin. Albumin coagulates when heated. 9. Place used dropper in waste receptacle and proper disposal reduces the spread of microorganisms. Lastly, do after.
Ma'am, pwede ko mamayo sa inyong ihi ko? Ma'am, sa pagkuha niyo sa inyong ihi ko, sa tunga-tunga ko sa inyong pagpangihi mo mag-touch ha.
For the preparation of urine test for sugar, first is the test tube holder, match, kidney basin, calibrated medicine glass, alcohol lamp, dropper, Benedict solution, and last is the urine specimen.
So for the procedure of urine test for sugar, first is to measure 5 ml of Benedict solution in medicine glass and place inside the test tube. Second is to heat over the flame. And third is once it boils, the mixture for 5 minutes shaking at the same time. Once it boils, the mixture for 5 minutes, add 8 drops of urine. Fourth is to reboils the mixture, and after 5 minutes, observe for any change in color. The change in color will indicate the presence of sugar in the urine. So for the interpretation, no change in color or still blue, this interprets negative, and greenish blue, this interprets traces, and yellowish green, this interprets positive 3, and orange, yellow, or brick red, this interprets positive 4. So the presence of sugar in the urine may indicate diabetes mellitus. Always refer the client to the physician. Then, open the bag and return all things used in their proper order. Fold apron and towel with exposed side inside. Then close the bag. Sit down and have a talk with the mother or the person in charge of the patient. The record, observation, the temperature, the treatment done, and the specific instructions given, then make an appointment for the next visit. Then see that the waste receptacle with its contents is properly disposed of before leaving home. Take note that using this opportunity to check sanitation of immediate environment or waste and garbage disposal, drainage, and etc. Proper disposal is necessary to prevent contamination. Lastly, pick up the paper lining by its center fold and discard.